Hey everyone, I'm sorry I can't be with you in person today, but I am going to run through some slides for you to give you an update on our outcomes data that we watch, as well as some of the data that we have on interventions that we're using. I'll walk through the data that we have on overdose deaths and emergency department visits, demographic risks, substance risks, and some of the prevention strategies, use of naloxone, risk reduction, and treatment. This slide shows the overview of the number of overdose deaths we've had in Lancaster County, going back to 2010 and coming up to what we have reported for this year to date. So we had the exponential increase in overdose deaths starting in 2015 that continued through 2017. Then we had a pretty sizable decrease in deaths in 2018, 2019, and then another increase again last year. In 2021 to date, we have 82 deaths so far, and that's about the deaths that have been reported through the end of July or so. Lancaster County was not alone in having an increase from 2019 to 2020. The US in general and Pennsylvania also did. So this slide shows that in the US, there were more than 90,000 overdose deaths in 2020, and that was an increase of 30% from 2019. In Pennsylvania, we had more than 5,000 overdose deaths. That was an increase of 16% from the previous year. And in Lancaster, as we saw before, we had 146, and that was a 40% increase from 2019. It's also important to note about this that the US numbers and the Pennsylvania numbers are only provisional, which means that they're not final and may change. This slide shows the cumulative overdose deaths by month going back to 2017 and coming up to what we have for 2021 so far this year. On this chart, the top purple line is 2017 data. That was when we had the most overdose deaths. The lowest line is 2019. That was in the past few years, the lowest number that we had. And you can see that for 2021, which is the brown line on this chart, we started out the year quite high in terms of deaths. We had numbers that were higher than most years that we've had in the past few. Since then, the numbers have come down a little bit, but we're still trending higher than we have the past few years. And again, we don't necessarily have all of the data reported from June and July, so it's still really too early to tell. This chart shows emergency department visits for opioid overdoses in Lancaster and in the state of Pennsylvania overall. So Lancaster is pink, or the lighter colored line, and Pennsylvania is red, or the darker colored line. So per capita, per 10,000 population, Lancaster has fewer emergency department visits for opioid overdoses. And there's really not much of a trend to this line. It goes up and down quarter to quarter, but there wasn't much of a trend until towards the end of 2020 and the beginning of 2021. There was a decrease in Lancaster in the number of emergency department visits. And that was when we had our highest number of COVID cases. And so that may have contributed to that. In the second quarter of 2021, on the far end of this chart, there's a little bit of an increase, which may be good. It may demonstrate that people are feeling a little bit better about going to the emergency department if they need to. The next few charts show the rates of overdose deaths per population for different demographic groups. So this first chart is age group. And what you're looking at is each group is a different line, and that shows the rate for that age group. And then on the far side of the chart, there's a percentage. That's the percentage increase from 2019 to 2020 for that particular group. So there are two things to look at on these charts. The lines or the groups that are at the top of the chart have the highest rate of overdose death for their population size, which means they're at the greatest risk. So in this case, that is the age group 25 to 34 and 35 to 44. We can also look at that percentage increase to see who might be at changing risk from 2019 to 2020 and think about what might have happened for that particular group. So for this chart, the age group 45 to 54 and 35 to 44 both had 100% increases or more, which means that the rate more than doubled in that population. When we look at the deaths by sex, again, so the top line on this chart is the rate for males and the bottom line is the rate for females. So that means that males are more at risk. They have more overdose deaths for the size of their population compared to females. And then when we look at the percentage increase, there was more of an increase for females from 2019 to 2020. They had a 63% increase in the death rate versus 31% in the male group. This is the rates by race. And here, both risk factors kind of point in the same direction. So to make the numbers meaningful, the Department of Health groups together all people of color in a group so that there's enough numbers. And so compared to the white population, people of color have a higher rate of overdose deaths for the size of their population. And also you can see that they had a more significant increase in that rate from 2019 to 2020. And then finally, this chart looks at people who identify as Hispanic or Latino versus not. And in this case, people who are Hispanic are at higher risk, but their risk stayed exactly the same from 2019 to 2020. So that might be something interesting to think about. What are the risk factors in that population that put them at higher risk, but maybe didn't get worse during the pandemic or in 2020? These are some slides about risk factors based on substances. So this chart shows how many deaths, what percentage of overdose deaths included each of these substances. And this data goes up to what's been reported through August of 2021. So the first substance there is fentanyl, and by far the biggest trend we've seen in the types of substances is that fentanyl has increased dramatically in overdose deaths. Heroin has decreased over time. We also had seen a decrease in prescription opioids in overdose deaths, but that increased again in 2020, and in 2021 is sort of trending along the same direction. In this chart, you can see that benzodiazepines have decreased as a percentage of being present in overdose deaths. Cocaine has remained about the same over time. Ethanol, alcohol, about the same. And then other illicit drugs includes primarily methamphetamine and amphetamine, and those have increased, as you can see, going back to 2015. The next few slides are about prevention strategies and interventions. So this chart shows the reported use of naloxone in the county going back to 2017 by EMS in the dark purple, law enforcement in light purple, and then Good Samaritans a little bit in the teal color for what we have reported from Good Samaritans. 2021 data is reported up through the end of June, so that's half of the year. So EMS administration of naloxone increased quite a bit in 2020. So if you think about how many deaths we had back in 2017, which was the peak, we clearly have a lot more EMS on the scene using naloxone in 2020, which is good. It either means that EMS are more used to responding to overdoses, having naloxone. People are more likely to call them to the scene, or both. I think it's also important to note in this chart that all of these are situations where somebody is at risk of dying of an overdose. And so when you think about the numbers of deaths in context of these numbers, we have between 100 and 200 deaths for all of these years. There are a lot more situations where people are at risk of dying and do not die because they had someone there who could provide naloxone. The next two charts are about prescription drugs and the risk posed by prescription drugs. So this chart is by quarter going back to 2016, and it shows how many people have a high dose of prescription opioids. So this is one of the ways we define risky prescribing. And this shows, again, Lancaster versus the state of Pennsylvania. So Lancaster is the light pink line and Pennsylvania is the dark pink or red. And both have trended down quite a bit over time. So the rate of people who have this sort of risky high level of opioid prescription has gone down a lot over the past 4 or 5 years. Another risky prescribing issue practice is considered having overlapping prescriptions for opioids and benzodiazepines. And again, those have come down both in Lancaster and in Pennsylvania over the past 4 years. One of the other things that's important to think about is getting people into treatment that need it. So we have some data from Medicaid patients about how many people have a known opioid use disorder or an other alcohol and drug disorder and have gotten treatment or not for it. So this chart shows patients who are in need of alcohol or drug treatment. So they have something in their medical record that they have a known substance use disorder. And then they look for whether those people have gotten treatment or not. And the darker colors on this map of Lancaster County show lower percentages of people who've gotten treatment. So greater need in darker regions. So you can see that the northern part of the county, somewhere around 40 to 50% of people have gotten treatment and the rest have not. And on some parts of the metro area, eastern, southern parts of the county, it goes up to more like 65%. So there's still a lot of people who are in need of treatment, but you can tell a little bit from this map about where some of the areas of higher need might be. And this map is similar. This shows patients with known opioid use disorder who are using medication-assisted treatment. And again, darker colors represent areas of greater need, lighter colors represent less need, more people in treatment. So over you can see towards the west on the border with York County, we have the highest percentages of people who are in treatment using medication-assisted treatment. And again, kind of the north, eastern side of the county might be where there is a higher need. And this is the last slide that I have. This is about medication-assisted treatment again. So we can look at the rate of dispensation. So how much buprenorphine are we getting out into the population based on the size of our population? This comes from the Pennsylvania Drug Monitoring Program, or the PDMP. And on this chart, I put Lancaster along with some of our surrounding counties for reference. Lancaster, again, is the light pink line. For most of this chart, we are the lowest on the chart, meaning that we have the lowest rate of people getting buprenorphine. Although towards the end, you can see that there was a noticeable increase at the end of 2020 and the beginning of 2021. So that could be a really positive sign for people getting connected with MAT. And that is the end of the slide. So that's the end of the data update.